Okay.
So this is going to be the test for plantar flexion and dorsiflexion. So for plantar flexion, you're going to test the soleus, which the origin is the posterior fibula, and the insertion is the posterior calcaneus. And it's also testing the gastrocnemius, which is originating at the posterior distal femur and inserting at the posterior calcaneus as well. And it's innervated by the tibial nerve. So for grades 3, 4, 5, the patient's going to start standing. They can hold onto a wall or the table for stabilization just with one hand, and you're going to ask them to maintain a straight knee and come up onto their toes. So for grade 5, it's going to be as many reps as you can. Greater than 25 reps would be grade 5. 24 to 10 reps would be grade 4, and 9 to 1 reps would be grade 3. Grade 2 would be the full range of motion, but in a gravity eliminated position, so that you would have your patient lying prone with their ankle hanging off the edge of the bed. You're going to palpate at the proximal calf and then just ask them to press their feet or their toes down towards you. So the full range of motion would be grade 2, grade 1 would just be a palpable contraction, and then 0 would be no movement at all.
Everything.
So for dorsiflexion, you're going to start your patient in short sitting. The muscle you're going to be testing is the tibialis anterior. So it's going to originate on the tibia and insert on the first cuneiform and the metatarsals. The nerve is a deep perineal nerve. So for the test, you're going to have them short sitting. The therapist would be sitting in a stool. And then you're just going to ask them to bring their toes up towards the ceiling. Good. You're going to stabilize at the malleoli, and then you're going to provide resistance over the top of the foot. So maximal resistance would be a 5, moderate would be a 4, and then no resistance would be a 3. 2 would be the full range of motion, but in supine. So having them lie on the bed, not with their ankles hanging off the edge. So the same thing, you're going to palpate at the tibialis anterior and just ask them to bring their toes up towards them. Good, and then relax. And then 1 would just be the palpation and